Hi, I'm Linda Nash, and I'll be covering prenatal precautions, patient education. I'll start by entering my patient's room, close the door and the curtain for privacy, and perform hand hygiene. Hi, ma'am, I'm Linda, and I'll be your nurse today. Can you verify your full name and date of birth? I'll verify 2 patient identifiers. Thank you, Ms. Jones. Your doctor mentioned you're newly pregnant. Congratulations. He asked if I would come in and review some precautions with you that we recommend to take during pregnancy to ensure a safe and healthy pregnancy. Is that okay? Great. All right, we'll start by talking about food. Most food is okay to eat during pregnancy. However, there are some that we recommend avoiding. The big ones are going to be things like raw or uncooked meat, seafood, and eggs, as well as unpasteurized dairy products or aged products like blue cheese, as well as deli meats and hot dogs, as well as any unwashed produce. All of these things can carry a risk of bacteria like salmonella, which can pass through to the placenta and then to the baby and cause developmental issues like seizures, paralysis, blindness, as well as it can cause preterm labor or even miscarriage, as well as toxoplasmosis, which is a parasite that can cause an infection that can cross the placenta. If the baby gets an infection, it can cause some severe developmental problems or possibly miscarriage. Additionally, some foods to avoid are going to be your high mercury containing seafood or fish, such as shark, swordfish, or king mackerel. The high mercury content of those can impact fetal brain development and can cause some neurodevelopmental issues. Also, excessive caffeine. We want to avoid it or at least limit our caffeine to 200 milligrams per day. It's also been shown to cause low birth weight or preterm labor. Some medications and supplements can be generally safe during pregnancy. However, you'll want to talk to your doctor before you start any new medications or supplements. We want to weigh the risk versus the benefit of starting new medication or a supplement or taking new medications during pregnancy. Generally, there are some medications that are okay, such as acetaminophen or Tylenol, that you can take for pain or fever, as well as Tums for heartburn, as well as any second-generation antihistamines like Claritin or Zyrtec for allergies. Those are all safe. We recommend after the first trimester, though, some medications that we suggest to avoiding are going to be like NSAIDs, so like ibuprofen or Advil or naproxen, as these have been shown to cause birth defects when taken during pregnancy, as well as some prescription medications are contraindicated during pregnancy, like ACE inhibitors for blood pressure. The doctor will review your medications with you and make sure that you don't have any contraindications. We also recommend avoiding aspirin unless your doctor prescribes it, as this can increase your risk of bleeding. Some acceptable supplements are going to be your prenatal vitamins, which we highly recommend. Other supplements are folic acid, vitamin D, calcium, and iron. These are all okay to take during pregnancy, but we want to avoid excessive vitamins and supplements, so excessive doses of vitamin A and vitamin E, and herbal supplements like saw palmetto, as it has been shown to cause birth defects. Mainly, all of your vitamins should come from food sources if possible. Also, some environmental exposures to be aware of while being pregnant is lead. Lead can be found in contaminated water as well as paint in old homes. And if you have any projects planned, maybe postpone those or delegate them to someone else, as lead has been shown to cause neurodevelopment issues like in babies. Other exposures like excessive heat, so avoid hot tubs, the sauna, any extended outdoor activities where it's hot and sunny. This can cause dehydration, and that can cause dizziness, low blood pressure, and can cause preterm contractions. It can cause and also for baby, excessive heat has been shown to cause neural tube defects, as well as it can cause miscarriage. Another environmental exposure to be aware of is to avoid pesticides. These can be found in your unwashed produce. They can be found in household products as well as outdoor garden and yard products. So be aware if you're doing any handling of these. Again, maybe delegate that task, as the pesticides have been shown to cause hormonal regulation disruptions with pregnant women, and if you inhale fumes, it can cause respiratory issues with the baby. It can cause neurotoxicity and affect fetal brain development as well. Of course, you want to avoid recreational alcohol drugs, recreational drugs, alcohol, and tobacco. We want to avoid all of these because they've been shown to cause miscarriage, term, birth, and maternal high blood pressure. And alcohol can cause fetal alcohol syndrome, which leads to cognitive impairment, and then it can also lead to the baby going through withdrawals at birth. Tobacco use can lead to low birth weight and defects in the heart and lungs. This can cause long-term complications such as asthma, cognitive, and behavioral complications such as ADHD, as well as SIDS, which is sudden infant death syndrome, and birth defects like heart and lung defects, as well as potential cleft palate, neonatal abstinence syndrome. So again, like with alcohol, baby will be born and go through withdrawal symptoms at birth related to tobacco. If you need any additional resources for any of this, just let me know and I'll love to help you, put you in contact with some of the resources and avoid some of these problems if they seem to be something you're concerned with. If you're planning to travel, it is recommended the safest time is during the second trimester, so in like week 14 through 28. Some of the things we recommend while traveling is to stay hydrated. We also recommend bringing a copy of your medical records just in case an emergency happens while you're out of town. If you're planning on driving, we recommend limiting that to 5 or 6 hours in the car a day and take plenty of breaks to get out and walk around, as prolonged sitting can cause blood clots in your legs. Wearing compression stockings while traveling either by car or by plane can help limit blood clot development in the legs. We recommend avoiding high-risk areas, so traveling to places where things like the Zika virus or malaria are prevalent is not recommended. You might want to consider limiting your travel during your third trimester when preterm birth or labor and preeclampsia are of higher concern. Finally, dental health. Pregnancy can actually cause some dental complications, oddly enough. It can cause gum disease and gingivitis due to hormonal changes. It can cause cavities and tooth enamel erosion from changes in diet, as well as if you're suffering from morning sickness and vomit frequently. The acid can cause dental issues. Visiting the dentist and having procedures is generally safe during pregnancy, and if possible, we recommend doing any of those procedures within the second trimester. Things like fillings and cleanings are okay, and x-rays can be performed as long as you have proper shields. Let me know if you have any questions or would like any referrals or resources for any of this information. I know it was a lot to take in, and I'll do my best to answer any questions you might have. Alrighty, perfect. I'll go talk to the doctor now, and we'll be back to see you in a few minutes. Thank you.